Okay, everybody. My name is Kaya Verich, and I am here to welcome you to the Thrive series tonight. Tonight, we will be joined by Dr. Florence John, physical medicine and rehabilitation physician from mHealth Fairview, as well as there are 6 different members from the cancer rehab team, speech pathology, occupational therapy, and physical therapy. Welcome to those of you who have been in attendance previously. This is the third of our sessions here in 2021. And if you're not familiar with the Thrive program, we are a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota, here to offer educational sessions to patients and caregivers who've had their lives touched by cancer. We will be recording tonight's session so that you may be able to refer back to them in the recording. And just to note, we do edit every recording prior to posting it to ensure your privacy. And we will get on with our topic about tips and tricks to help combat cancer-related fatigue, cognitive changes, and activity challenges associated with cancer diagnosis and treatment.
Good evening, everyone. My name is Florence John, and I am a cancer rehabilitation physician at the University of Minnesota and director of the Rehabilitation Medicine Cancer Program. And I am really happy to be here with you this evening to present on the topic of cancer-related fatigue. I know that this is a symptom that many of you experience as you go through your cancer journey and cancer treatments. And so my presentation today will really focus on the background of this topic, including the causes for this type of fatigue. And then I will also go into some detail of the strategies that we as your rehabilitation team use to help you when treating this fatigue. So to start out with, I just wanted to go over what cancer-related fatigue means, what it is. So we as your medical team define it as a distressing, persistent, physical, emotional, and then sometimes cognitive or mental tiredness or exhaustion that you might feel. And it is often related to the cancer and the cancer treatments that you're going through. The tiredness or exhaustion is usually totally out of proportion to any type of activity that you are doing that could potentially explain your symptoms. And it often interferes with your usual functioning. So those day-to-day tasks that you used to be able to do with ease become really difficult because of the symptoms that you're experiencing. We classify cancer-related fatigue into 2 main types: primary fatigue, which is related to the cancer itself, and secondary fatigue, which can be due to a variety of different causes, some of which are actually reversible. So when I say reversible, I mean that we as your medical providers look for them, can identify them, and can oftentimes treat or manage them, which can help decrease that contribution to your overall fatigue burden and decrease your symptoms. It's also important to note that you can have a combination of primary fatigue and secondary fatigue. So you can have a component of your fatigue that is related to the cancer itself, and then a component that is due to one or multiple of these other causes. This is a great pictorial that I just wanted to put up here and show to you, and I feel like it really illustrates all the different causes that can contribute to what we call reversible or treatable fatigue that I just mentioned. So I'm not going to review all of these on this slide right now, but I am going to spend the next few minutes one by one going over each of these causes and some of the details, and then also some of the ways that we can manage these different causes. So to start out with, I wanted to talk about anemia. I know this is a condition that many of you have already experienced or will experience as you go through your chemotherapy treatment regimens. It is a decrease in the amount of red blood cells or hemoglobin in your blood. Hemoglobin is a protein that helps carry oxygen in your blood to the rest of the tissues in your body. And chemotherapy medications often will decrease the levels of hemoglobin in your blood. And when hemoglobin gets low, it can really contribute to significant tiredness and fatigue that you're feeling. It is very common in cancer patients because, as you know, most cancer patients go through some sort of chemotherapy regimen. And so it does occur in about over 50% of cancer patients. And I actually think that this percentage is even higher. There are a variety of treatments that we can use to help treat anemia. And I'm sure that many of you are aware and know that when you come in for your chemotherapy sessions or your oncology visits, that your medical providers have often ordered regular labs at regular intervals. And one of the reasons that they order these labs is to check your blood counts, including your hemoglobin, just to make sure that they are not getting too low and contributing to other symptoms and risks. And so some of the treatments that we use to help with anemia include medications such as Neulasta, which some of you might be taking or on. So this is an injectable medication that's usually given shortly after your chemotherapy medications are given to you. And it helps to stimulate the cells in your bone marrow to produce more cells of all types, including hemoglobin, and bring those numbers back up. If your hemoglobin gets very low, sometimes you might need a blood transfusion to help bring it back up. And then if you have iron deficiency anemia due to nutritional deficiencies, sometimes we'll help by replacing the iron to bring the numbers back up. Nutritional deficiencies are another reversible cause of fatigue. And so this is something that both myself as your rehabilitation medicine doctor and your oncology providers will really screen for when we think about fatigue. As I am sure many of you have experienced, side effects of chemotherapy and other medications really cause you to have oftentimes very low appetite or poor appetite, nausea, and you really struggle to get some good nutrition in your body. And so this can result in deficiencies, the first of which are electrolyte deficiencies. So electrolytes are minerals in your body that are dissolved in your body fluids and are really important for nutrition and other functioning aspects of your body. And so I've given you examples of some of these up here on the slide, like sodium and potassium. So sometimes if we suspect that you might have low electrolytes, I'll order labs in clinic to check those levels, because if we do find that they are low, we can often replace them either orally or by other means. Albumin is an essential protein in your body, in your blood, and it helps to carry medications and hormones, and it helps with clotting to prevent bleeding. If your albumin level is low, it is often an indicator of malnutrition or poor nutrition. And so what we'll do in those situations is oftentimes get a nutritionist on board to help with nutritional supplementation for you to try and get those levels back up. Coexisting medical conditions such as heart disease, lung disease, kidney disease. Many of you might have been diagnosed with one or more of these conditions either before your cancer diagnosis or even after your cancer diagnosis. So they can coexist as you're going through your cancer journey. And you can have symptoms or flare ups of these diseases. And so, oftentimes, as medical providers, we will look for these types of conditions or signs and symptoms of these. And if we suspect that this might be contributing to your fatigue, we will further investigate these, not only to help control your fatigue symptoms, but also to help treat that medical condition and get it more under control. Hormone dysfunction is often something that we don't think about as often, but certain chemotherapy medications can affect hormone levels. So, certain chemotherapy medications can cause decreased thyroid hormone levels. They can also cause decreased cortisol levels. And cortisol is a hormone that's actually produced by your adrenal glands, which are small glands that sit right up top on top of your kidneys, and cortisol is responsible for energy levels in your body. So as you can imagine, if your cortisol levels are low, your energy levels will be low and contribute to you feeling more tired. And then lastly, decreased testosterone can sometimes occur with certain radiation treatments for certain types of cancers. Pain is really a large component of fatigue and decreased functioning that I see in my clinic at times. There are a variety of different causes for why you might be experiencing significant pain. It can be caused by the cancer itself, by cancer treatments. It can be joint pain, muscle pain, bone pain. You can have certain injuries like a rotator cuff injury or what we call a frozen shoulder. All of these things can contribute to pain. So, as you can imagine, when you have significant pain that is incapacitating, it really affects your ability to move, to function every day, and can contribute to you just not being able to do normal activities, and then can contribute to your overall feeling of tiredness and fatigue. And so, what we as medical providers and what I do in a rehabilitation medicine clinic is I will really look for the cause of what is contributing to your pain. Sometimes it's multiple things, but sometimes there's one large cause for why you're feeling so much pain. And once we're able to investigate that and pinpoint that cause, there are a variety of different treatment options that we can offer, such as medications, including oral, topical, some injections, joint injections, or muscle injections for joint or muscle pain. And then we also sometimes monitor for activity restrictions. So if you have cancer spread to the bones in your spine or the bones, your long bones in your body, oftentimes I will talk with both your oncologist as well as your surgeon if you've had surgery, just to make sure that there are not some activities that we should avoid as we try and get you up and moving and stronger again, working with therapies and myself. And then lastly, our therapists are a great group of providers that help you with aerobic exercise, strengthening those muscles, and then bracing and splinting for certain joint and muscle conditions, which can help alleviate some of your symptoms. Sleep disturbances are another big contributor to daytime fatigue. As you can imagine, if you are having trouble falling asleep or staying asleep with many wakeful episodes during the night, this can really affect your daytime functioning and just cause you to feel really exhausted and tired during the day. There are multiple causes for why you're getting poor sleep. The tumor itself, the side effects of the tumor treatments that you're undergoing, the stress and anxiety and emotional health that could potentially be keeping you awake at night. That is really a large contributor that patients often talk with me about and complain about. And then other health problems, specifically a particularly commonly undiagnosed problem is sleep apnea or obstructive sleep apnea. And so this is when you have really brief periods of cessation of breathing overnight that occur on and off throughout the night, just a few seconds here and there sometimes. And it can cause decreased oxygen levels in your blood. So that way, when you wake up in the morning, you don't feel well rested. You feel really tired and fatigued. And so we will screen for this in clinic. And sometimes if we suspect this, we will refer you to a specialist for further workup and treatment. And oftentimes the treatment involves using a CPAP machine, which is a machine with a mask that helps with your breathing and helps sometimes to provide some oxygen overnight. So that way you can feel better and well rested in the morning. The way that we manage sleep as a team is we try to manage the side effects of the cancer treatment that might be contributing to why you're staying awake at night. I really talk a lot with you about stress and your emotional health and how this might be contributing. Our therapists are great at reviewing strategies for sleep hygiene. And then lastly, we do use sleep medications to help you with sleeping through the night and getting adequate rest at night. About 30% of cancer patients use sleep medications to aid with sleep, so that way you can get better rest and feel more awake and rested during the day. Emotional health. This is another big contributor to fatigue. It can make you feel tired and exhausted. It can make you not want to function during the day because of how you're feeling emotionally. what you're going through with your cancer journey and diagnosis. As you are well aware and know and experience, it's a really, really stressful situation. And so adjusting to the new normal, the distress of it all, the anxiety and the feeling of feeling down and depressed can really, really affect how you feel and function during the day. And so I always tell my patients, really important is for you to be aware of these feelings. And if you're feeling this way and finding it really difficult, definitely talk with someone from your support system. And so your support system can include your family, your friends, your medical providers, your oncology team, your rehab medicine doctor like myself, your therapist. Just reach out to somebody and let them know how you're feeling, because there are a variety of different methods and ways that we can help you with your emotional health as you go through this. Support groups and counseling are things that I know patients have mentioned to me in the past that have really helped them, being able to talk to others who are going through the same thing that you are. Mindfulness, meditation, and spiritual support are often helpful as well. And then there are medications that we can offer you to help with the emotional symptoms that you're going through too. I just wanted to spend a few moments talking about cognitive fatigue, as I know this is a symptom that many of you experience due to chemotherapy, radiation, or surgery. It is basically, these are symptoms based on direct injury or effect to your brain from chemotherapy medications, radiation, and surgical intervention. These are symptoms such as memory difficulties, like short term memory difficulties that you might be noticing, deficits with attention. So you notice that you don't have great attention when speaking in conversation or when doing daily tasks as you used to. You have slower processing when you're in conversation with someone. You're not able to really pick up what they're saying or understand what they're saying as well as you used to. And then what we call executive functioning, which includes symptoms like difficulty initiating tasks, simple tasks that are day-to-day tasks that you used to do. You find difficulty starting those tasks and proceeding with them. And executive functioning is often affected as the front part of your brain or the frontal lobes are affected by chemotherapy or other treatments. So again, if these symptoms are bothering you, are really something that you have noticed and significantly affecting you and your functioning, mention them to your medical providers or your team. There are screenings that we can do in clinic. Often our therapists and psychologists can do detailed evaluations to tease some of this out. And then there are also a variety of treatments that we can offer you. Our therapists are great at teaching you compensatory strategies and brain exercises to help with these symptoms. And then there are a few medications that we can offer you as your medical team that help certain patients with these symptoms as well. So this slide is just an overview of everything that I just talked about in my presentation, going over the rehabilitation strategies that we as a team use. So on the left side of the slide here are all the medical strategies that I talked about that myself as a rehabilitation physician can help you with in clinic. Just that diagnostic workup and management and treatment of all those reversible or treatable conditions that can contribute to fatigue. And then on the right side of the slide here are all the therapy strategies that our awesome group of therapists can help you with. And they include the strengthening and endurance for deconditioning or generalized weakness, relaxation techniques, conservation techniques, and then the sleep hygiene and cognitive techniques I talked about as well. So I just wanted to end by just reemphasizing that our approach is really a multidisciplinary, holistic approach to helping you with your cancer-related fatigue. So it involves an entire team, your oncology team, your primary care physician, myself as your rehabilitation medicine physician, or PM&R, and PM&R stands for physical medicine and rehabilitation doctor, your therapist, and then, as I mentioned before, we often get psychologists and nutritionists on board to help with those pieces when we see that those are part of the picture. And so we really try and tackle this from all angles to help decrease the symptoms and the tiredness and exhaustion that you're feeling, to help you feel better and be able to function day to day. So this slide just goes through some of the references that I used to put together this presentation for you today. And I wanted to just end with a quote. I'm not sure if any of you have seen or heard or read this quote anywhere, but it is by Arthur Ashe. And it is a great quote that I often refer to back myself for my own personal use and personal reasons. And it's just great, very inspiring words for me, especially when we are going through some difficult challenges in life. I hope it inspires you as well to start where you are, use what you have, and do what you can, all with the intention to get you back to doing some of those things that you really enjoy on a daily basis and help fulfill your life. And so this is a great segue into what our awesome group of therapists have to be presenting to present to you today. They will be presenting variety of different strategies that they utilize to help you in treating cancer-related fatigue. And so it's been great to present this topic to you today. And I look forward to, along with our therapists as a team at the end, being available to answer any questions that you might have in relation to this topic or your cancer journey itself. So thank you so much and take care.
Good evening. My name is Lisa Nike. I'm an occupational therapist here with mHealth Fairview, and I'm joined here today with Krista Fole, another occupational therapist. We both specialize in helping folks with cancer, and we'd love to talk with you today about how OT can help you with the impact of fatigue following cancer. So we'd like to share with you today on how OT can help with the impact of fatigue. So I wanted to start off by taking a little survey, a thumbs up survey. So I actually want you to turn on your cameras and engage with us just a little bit. It's great for us to see each other's faces and to see who else is attending today. So that's wonderful. You can always turn off your cameras after we're done. All right. So my first question here, show me a thumbs up if you can relate to this. I have to take a nap every day in order to function now. If I do all the steps to make dinner, I'm not guaranteed to have the energy to be able to eat it. I feel like I'm awake, but in a deep fog, and it feels like the world wants you to wake up from a deep, deep sleep and put on your running shoes, but it's just not going to happen. My brain feels active and going, but my body feels like I've never slept in my life. I just can't understand why I don't have what it takes to do 2 appointments and grocery shopping on the same day. So those are some ideas of how other people have felt affected by fatigue. Krista, can you tell us a little bit more about fatigue and how it affects folks who are surviving cancer?
All right. Well, a lot of times occupational therapists get individuals coming in with fatigue. And I think it's important to kind of define what cancer-related fatigue is, as well as typical fatigue, what we think of kind of in our daily lives. So typical fatigue, again, that's that non-cancer related fatigue, that's situational. For example, if I stayed up way too late, woke up the next day and was tired, I could catch up on my sleep by going to bed earlier the next few days or even taking some naps. Another example would be if you have young kids or have had young pets where you get up multiple times during the night and feel very tired in the morning. So really typical fatigue can be resolved or treated with increased rest, again, improved sleep, getting that deep sleep, or also just kind of reducing stress in your life. So now we jump into cancer-related fatigue that Dr. John touched on earlier as well. And really it comes from many factors. Again, not only from the disease itself, but also side effects of treatment and medications, situations surrounding the disease that can be controlled or not. Again, it's kind of that invisible, what we call leftover of cancer, a lot of times, you've done all the hard work, you've gone to your infusions, your radiation appointments, you've done the chemotherapy, and you think that you've gotten over that hump, but then again, you still kind of have this ongoing fatigue. And the thing with cancer-related fatigue is it doesn't typically improve, or not substantially, with that increased rest or getting more sleep. So we talk about two types of fatigue. Primary fatigue is one of them, and then also reversible or secondary fatigue. So with primary fatigue, that's really due to the disease and the disease process itself. It might actually be the reason why you ended up going to see a doctor in the first place, this fatigue, this sense of tiredness that, again, your nutrition levels didn't change, your activity levels didn't change, your stress levels didn't change much, but again, just kind of this extreme fatigue, and you don't really know why. Again, it might be due to the disease itself, the cancer, and kind of what it does to our cells, kind of that internal change of our body. Again, treatment is really talking to the doctor that you are working with to see if there's any nutritional deficiencies, checking lab values, seeing if anything can be adjusted in that way. Again, adjusting kind of your treatment regimen, or maybe even medications, changing days of the week, frequency, that kind of thing, but really talking to your doctor to see what can be changed kind of more from a medical standpoint. And then a very beneficial reason to come and see an occupational therapist to work on this reversible fatigue. Again, the fatigue that's due to side effects of medications or the treatment itself. Examples of reversible fatigue or why it's happening is deconditioning, depression, poor nutrition. Again, deconditioning, that's a tricky one because it's just this cycle of you're feeling fatigued, the thought of doing anything more than just kind of getting up and being awake for the day seems to be too much, but really it's important to get activity for two reasons. One is to prevent atrophy, reducing muscle. You need muscle to move, but then also we think about activity. We kind of forget that activity can it produces endorphins, so it kind of gives you this high after you do an activity, whether or not that's a traditional exercise program or just getting up and moving your body. Again, with depression, that's anything that's kind of surrounding the diagnosis itself, treatment, just not feeling like yourself. Poor nutrition, again, talking with your doctor about that, but sometimes it can be reversed or definitely improved. If you get that good nutrition, your body is getting more energy. Again, poor nutrition can be anything from food not tasting right because of chemotherapy, having mouth sores, if you had a head and neck cancer, and radiation kind of is affecting some of that internal feeling in your mouth. Makes it hard to eat, or the desire to eat has definitely changed. Again, treatment for reversible fatigue is really working with your therapy to see where you can modify the sources of fatigue. Is really important because usually we can give you some suggestions. Dr. John touched on cognitive fatigue. We'll touch on cognitive fatigue a little bit later in this presentation as well, but that is another type of fatigue kind of related to cancer. So when you come to therapy, how do we deal with fatigue? What can we do? And a huge component is what we call energy conservation, really budgeting your energy. How do you get rich? We want to save our energy and then spend it where we want to. And I think that's really important. There are the things that you need to do, getting up, getting dressed, taking a shower. But there's also the activities that you want to do. Again, this might be a little bit more non-COVID times, but being able to see family and friends, going to a sporting event, a concert, attending a picnic, anything like that. So really pairing a want with a need is important, because the wants, the things that you desire to do, are just as important as the activities that you need to do. So how do we save our energy? Really with our day, it's all about pacing activity, pacing a big activity or big job with a little one, and also sprinkling in rest breaks throughout the day as well. Really being realistic about how many activities you can achieve during the day, not trying to overdo it. Really, we suggest, starting with 2 activities, increasing that as your energy level increases, the biggest piece of planning your day is really taking rest breaks before you need them. So you don't go, and then you're completely tired for the rest of the day. And then along with that is saving your energy or conserving your energy through the week. So really scheduling your weeks, using a planner, again, planning those big days, those big activities with more restful days. Scheduling, if a big day would be, for example, going to your doctor's appointments, you're going to get dressed, you have to drive to the appointment, wait for the appointment, sit through the appointment, take in information as well. That's a big day. So making sure that you're not going to try to plan another activity after that, or even making sure that you're not going to plan a busy day the following day as well. So a big take-home message with cancer-related fatigue is really that energy conservation and budgeting your energy.
So it's really important not only to plan your day and your week, but also to engage your friends and family members in how you're doing. This is one of the things about fatigue. It's like the invisible leftovers of that cancer journey. You're looking good, you're moving good, you don't have to do as many treatments. It might even be in the past. But it's one of those things where it's still important to name the fatigue and to make plans around it because it's part of a lot of people's journey. So I'd like to suggest that you use a rating scale of your effort level that you can use with your family and friends. So this is kind of what I use. We use a 10 for being really exhausted. We use a 0 for no effort at all. And, so maybe your daily activities of getting ready in the morning, brushing your teeth, getting dressed, kind of rate 2 out of 10. If you went grocery shopping, maybe that would be a 5 out of 10 for a 20-minute run, and maybe the last 15 minutes took a little longer than you thought, and maybe your effort level goes up to a 6.5. It's important, to take a rest, somewhere between 6 and 7. We know that the effort level between 7 and 10 can escalate really quickly. So it's important to kind of put a name on it, and let people know, I'm going to need a 5-minute rest before we go and make it through the rest of this grocery trip. And so I think it's important to know that, maybe at a 7 out of 10, you might have like 5 minutes in your tank left and might be able to make it out to the car, but maybe your partner needs to be the one that checks your groceries out and meets you out there. So it's important, to be able to name your effort level and use that to kind of anticipate what your needs are in future outings. And it's also important to talk about, that there's an old you that used to be able to do all of these things, and you still have it in your heart that those are all the things that you want to do. But we know that the new you is just slightly different, and we have to consider the effort level that it takes to be able to do all of those big long chains of activities. So with that, it's good for asking your family or friends for help in advance before you go out and do the big hard things. So I'll give you a few ideas on what those are in a little bit. After those big events, what does a good recovery look like? Good recovery should, if you are going out for a 2-hour shopping trip and you can recover with a 30-minute rest break afterwards, just putting your heels up and maybe reading the newspaper, that's a great recovery. But if that same shopping trip causes you to be exhausted for the rest of the night and not be able to eat dinner, then that's an extended recovery. So more than 2 hours of recovery is really like a whole new healing event. So it's important to be careful about that. So here's some ideas on making life easier with fatigue. Let's plan stir fry for tomorrow night's dinner. So in the morning, you might get out the dishes, you might chop the veggies, you might marinate the meat and make the sauce. In the afternoon, maybe you'll put the rice in the rice cooker or bake that up in the oven. At 5 o'clock, after having a nice rest, saute the dish together. And while you're eating, maybe you can heat up a nice sink of hot water and soak those dishes while you rest before you wash them. or better yet, wash them together. Making it easier could also apply to like getting ready for a big family picnic. So maybe taking your shower the night before and saving your shaving for the day of in the morning, and do that while you're sitting. Maybe on the way to the picnic, from the car to the picnic, you would maybe use a transport wheelchair and have your, save your steps for when you're walking around visiting with people. And then for the trip home, use that transport chair back to the car. You could also sit to visit with your family members so that you can enjoy that and save your breath and let them come to you. Plan for how long you're going to stay. It's often easier to come early and leave early and avoid the helping out with the cleanup, as we all, like to pitch in, but it's a very long event when we do set up all the way to the cleanup. And then, of course, using that communication strategy to rate your effort level with your family so that they can understand when you are fading before you are completely sunk. Yeah, we want to try and take those breaks between 5 to 6 out of 10 on the effort scale, where 10 is great effort. So the final takeaway on managing fatigue is definitely taking the time to plan your day and week. Scheduling your day and week tasks to include what you want and both need to do. Modify your sources of fatigue, whether it's emotional, physical, cognitive, but above all, keep on living. So now we're going to have our friends Paula and Danielle from speech therapy discuss ways on how to help with cognitive fatigue. Thanks.
My name is Paula King, and I'm a speech pathologist with mHealth Fairview. I often see clients who've completed their cancer therapy, and a lot of times their concern revolves around cognitive linguistic deficits, such as memory, organization, being able to think of the words that they want to say. So tonight, I would like to give you some tips of strategies to use to help with your memory. Memory deficits are really a challenge and frustrating for people. And so I have two different areas regarding memory for strategies. The first one is internal strategies, and the other one is external strategies. So I'd like to start off by talking about some of the internal memory strategies that we can use. So an internal memory strategy is where you are retraining your brain and you are retaining information maybe in a different way than what you're used to doing. Looking at this first slide, I have listed 3 different strategies. The first one is when you rehearse or you repeat something as you're doing it. And this is great because you're using all the different ways that you might learn, such as auditory learning, visual learning, learning as you do. So the example I have is, let's say you need to remember to unplug your curling iron when you're done in the bathroom, or it's time to go to bed and you need to make sure that you shut the windows before you go to bed for the night. As you're doing that action, you might go to the window and say, I am shutting my window. I'm shutting my window. And also repeating that is helpful. And then when you're laying in bed and you're wondering, did I shut my window? That will often pop up that you'll remember that you talked about it. And so that's one strategy. Another one is called mnemonics. And mnemonics is basically if you had a list of words that you needed to remember or a list that you needed to remember, you're going into the grocery store, you didn't write a list, but you know you need to get apples and carrots and bacon. You would take the first letter of each word and see if you could come up and create a different word. So carrot starts with C, apple is A. So you might form a word like cab, and then when you're in the store, remember the word cab and see if you had those 3 items. And then a third idea is called chaining. And word chaining is where you need to remember, let's say, a list of 3 words. So the 3 words that we want to remember are parking, theater, and ticket. And so I'm going to take the first 2 words and chain those together by making a sentence. And then I'm going to take the second and the third word and make a sentence to chain those 2 together. So to chain parking and theater, I'll come up with a sentence, and it would be, there is a lot of parking at the theater. And then a second sentence for chaining the second and third word could be, when I get to the theater, I need to buy a ticket. So now, can you remember what those 3 words are? Think back to those sentences that we talked about. Parking, theater, ticket. The next set of strategies are called external strategies. And this means that we are referencing something externally from our brains so that we can be reminded, or we can reference and look to help us remember. So this next slide talks about a couple ways of referencing. One is keeping a list. A lot of us do this all the time, and it's great to still do, whether it's a grocery list or a list of things to do. It's also important to help with your knowing that you have that fatigue, possibly, that you are prioritizing what you really want to get done in that day so that you have enough energy for it. Journals, planners, calendars are great ways of referencing. I like planners because I can open it up and at a glance see the whole week. They also usually have side areas where you can make notes or make a list. It's portable. Calendars are great too. Also, besides just recording the appointments that you have upcoming, you can use that as sort of a journal too. So if Aunt Kathy stopped by as a surprise visit, you could go into that date and write in that Kathy visited. And then later on, when you're talking to your family and wanting to reference who came by this week, who stopped by, you can also go back and look at it as history of what happened that week. And then using technology these days with telephones, or the cell phones, there's apps that you can use, alarms, timers, things that trigger your attention for you to remember what the next task is that you have planned to do. And then I also like Post-it notes. Those are great because they're just sticky and portable, and you can stick them wherever you want to help remember. It's best to pick one strategy and practice that. And if it's going well, then add another one on. I don't want this to get too overwhelming. So pick one, and feel free to also enlist your friends and family and let them know what you're doing so that they can help. They're really great with support for that. The other thing is that all of these strategies, because they're fairly new, really take some active work on your part. So knowing that, you can do it, but you need to put in the work to have these stick. And the more that you do it, and the more that it becomes a routine, that's how it becomes a habit. And then once it's a habit, then you're on your way for better memory. The areas of remembering a specific word, such as someone you've met, or, I just can't think of the word while I'm talking. That's an area that we are going to have Danielle talk to you about, and she's coming up next. Thank you.
Thank you, Paula. My name is Danielle Schneeman, and I'm also one of the speech language pathologists who works with our cancer rehab patient population. I wanted to talk to you today about word finding deficits. While word finding deficits are not truly deficits in cognition, people who experience word finding deficits often describe them as an inability to remember names, and they link this deficit to memory itself. Word finding is also known as anomia and can be defined as the inability to express the word when you want to use it. I have 2 clinical examples that can help you understand word finding deficits. In the first example, Sarah and her husband are in the kitchen and they had decided to have eggs for breakfast. Sarah asked her husband, "Can you get the they're in the fridge." And in example number 2, Eric is asking his son to get the paper towel after a spill. He said to his son, "Can you get the toilet paper? Get the toilet paper." "No, not that." I don't know. With word finding deficits, the individual knows the word that he or she is trying to say, but is unable to get the name out. Often, he or she is able to state a related or a familiar item and even describe the item, but they can't get the name that he or she knows as the most accurate. This can be extremely frustrating as it occurs on simple or familiar words and often on words that the individual is able to get out accurately and with ease at some times. So, this deficit limits an individual's ability to express oneself in a clear and concise fashion, but it also may impact an individual's confidence in his or her abilities. And it sometimes will limit an individual's interactions with others because there's an underlying sense or fear that he or she may lose a word, and that might result in some embarrassment. If a patient has been referred to us and we suspect a word finding deficit, the first thing that we are going to do is we are going to complete an evaluation. This evaluation can be done in person or via video. During this evaluation, we would look at an individual's ability to understand and express language. From there, if a word finding deficit is identified, then specific goals are developed to be addressed within treatment. Treatment typically includes a variety of exercises designed to increase one's ability to state the labels of words, to identify when word finding deficits are happening, to train compensatory strategies for these deficits, and build confidence in linguistic skills. We wanted to take some time now to address some compensatory strategies, as they're so important. So, compensatory strategies are things an individual can do when they cannot state the word. So these are things that will help get the point across without actually using the word, the target word. The first of these is to pause and to pace yourself. Be patient. Let the listener know that you may need a second and that it's okay. Another compensatory strategy is to describe. State what you can about the item, such as what it looks like, what it does, what it's used for, where it's located. All of these details can help your listener along. The next strategy is to associate, to tell something that is similar in meaning. One can also provide a synonym or the first letter or first sound of the word. Sometimes stating the category to kind of narrow it down can be helpful for your listener and for your brain to get at the word itself. Gesturing can be helpful, and drawing can also be helpful. I think it's fair to say that each strategy doesn't work every time, and it's okay to say no big deal, it will come to me later. So what we'll do next is we will apply our compensatory strategies to our two clinical situations that we described earlier. In clinical situation number 1, Sarah was asking her husband to get the eggs. With the use of compensatory strategies, her request could change and look like, can you go to the fridge? Can you get the they're white, they're round, they come from a chicken, you have to crack them. And then her husband chimes in, oh, the eggs. In clinical situation number 2, Eric was asking his son to get the paper towel, but it came out, can you get the toilet paper? With use of compensatory strategies, the situation would look like, can you get the toilet paper? No, not the toilet paper, the other stuff. We keep it in the kitchen. It's taller than toilet paper, maybe scratchier than toilet paper. The paper. The next word starts with a T. The paper towel. I think it's also fair for us to add that we were limiting our scope of information to fit within the context of this presentation today as we're discussing cognitive issues. But I think it's also important to note that we as speech language pathologists also address deficits in speech, voice, and swallowing that sometimes accompany cancer treatment. Thank you for your time. And this will conclude our word finding segment of today's presentation.
Hello. So we're going to make it easy on you tonight. We've got two more Lisas presenting. My name is Lisa Caro, and I'm a physical therapist here with mHealth, and I typically work at the Egan Clinic.
And I'm Lisa Nelson, and I'm a physical therapist as well, and I work at the mHealth Cobblestone Rehab Clinic.
So we'll be talking to you tonight about exercise and its role in cancer rehab. So since we're talking about exercise, it's always important to check with your healthcare team prior to starting any new exercise program. So why exercise? If you could take a pill that would help your overall health, decrease that risk of cancer and cancer recurrence, would you take it? That pill is exercise. So research does demonstrate that it reduces the risk of cancer as well as cancer recurrence. It decreases fatigue, opposite to what you'd think. When you're exhausted, how could you possibly take that walk around the block? But it actually does decrease that fatigue when you comfortably do exercises and do all your pacing that you've learned. If you think about a typical day today versus a typical day before cancer, a lot of times you're a lot less active. And when you're a lot less active over the course of weeks and months, it can cause that deconditioning, which worsens fatigue. So exercise does help that fatigue over time. It will assist in your return to prior activities, whether it's in the home, cooking, cleaning, laundry, getting back to your work, and hopefully at some point we'll want to get back to our social and community activities. It helps with overall wellness and improved quality of life, as well as addressing secondary side effects of cancer treatments from surgery, radiation, chemotherapy. It increases blood flow and may help with nerve healing if you're dealing with things like neuropathies. And certainly it has the emotional benefits, the release of serotonin, the body's natural feel-good chemicals.
As Lisa was saying, for exercise, you may first want to start out just doing your general activities. I think the important thing to remember is that any movement is exercise. Sometimes we get caught up in that we need to go to a gym, we need to get up and go work out for an hour longer, but really just any movement is what we want to impress upon you is exercise. Some ways to work that into your day is during commercial breaks. If you're watching TV, just get up and stand and move around in place. And we'll go over a couple options of those exercises shortly. And then when you first start out, you may be tired. So starting out shorter periods of time, but more frequently throughout the day, for kind of doing the math, hitting that goal of 30 minutes a day. So say you can tolerate 5 minutes of walking around your house. Get up and do that 6 times a day. If that seems too daunting, then just do 3 and add up to that time. As you can tolerate longer periods of time, then you can decrease how many times you do it through a day. The goal is about 30 minutes a day and working up to 60 5 days a week. And what you want to do is work at a somewhat hard level. And that means where you can tell that you're exercising, you're doing more than your regular activity, but you're still being able to talk to somebody or have a conversation. And then when you're feeling stronger or getting better, you want to add in some strength training, balance exercises if you need, and possibly some stretching. The stretching is important to do as well after when you're incorporating or starting an exercise program. However, research has shown as well that focusing on the aerobic fitness is the first thing to go for. So if you're short on time or feeling stressed out, go for that at first. And then, like Lisa said, checking with your physician before starting an exercise program. And your key to the exercise is if something is painful, go ahead and stop. examples of exercise you can do, like we talked about using the commercials as part of your daily routine, and just a reminder for you to do some movement and exercise if you're watching TV. Sit at the end of your chair when the commercial comes on, and you can do just marching in place, or even kicking your legs out in front of you. And you can add your arms to the exercise. That'll further increase your heart rate and your breathing challenge. And then with these two, you don't have to worry so much about repetitions, but think more about going for as long as you can. Again, working at that somewhat hard level. You can also add in sit to stands with this too. Scoot to the edge of your chair. If you need some hand support, you can, or if you even reach out in front of you, that will help get your body weight forward and make the movement easier to complete. You can change how you move your arms. You can increase the challenge, arms across your chest. Okay. If you have stairs available in your home, you could use them as if you're at a step aerobics class, and you can just step up and down the steps. Again, try to let your legs power you up the steps rather than pulling with your arms. Every 5 to 10 repetitions, go ahead and switch feet. You can also add just going up the step. Of course, doing stairs is exercise in itself, but if you're a little weak and you're challenging yourself, it's safer to do it this way than to go up and down the steps. You don't want to risk a fall. Another option you can do is modified jumping jacks, working your way into a more challenging activity, doing the full jumping jack, adding different movements. Again, with these, adding the arms, and you can also add a little bit of weight. You don't need weights. You could hold a simple can of vegetables, fruit, a water bottle. 16 ounces is a pound. And the big thing to remember is to avoid pain with any of these. Another one is just simple heel to toe raises. All right. And one thing to remember with that is when you first start with exercise, it is a physical demand to your body. So you might feel tired at first, but just keep going for that 3 to 5 minutes. Let your body adapt to the activity. And some days you might just be too tired and you just want to stop. That's okay, but at least give it the try. And sometimes you'll get to that 3 to 5 minutes and you'll want to keep going.
So when should you see a physical therapist? If you're noticing you're still having difficulty completing just daily tasks, if you're continuing to have significant fatigue and decreased energy, if you're dealing with some pain that might be due to joint, muscle, or tissue restrictions, and certainly if you're noticing any balance concerns and falls, those are definite cues to ask for a referral to come see a physical therapist. We work with anybody who's previously exercised and has had difficulty just returning to leisure and work activities, to individuals who've never exercised before and just don't even know where to begin. We can help with those. PT is beneficial at any point along your cancer rehab journey. We can see you during treatment. We're very good at working with your providers and looking at lab values to make sure that we're progressing you safely. We work with people who have completed cancer treatment, potentially even years following, if they're just not getting back to their prior activity level. We even see people in something called prehab. So if your physicians or providers have noticed any impairments or problems that they think would benefit from our services prior to a surgery, radiation, or chemotherapy, we can work with individuals in that setting as well. So we're looking forward to working with you, whether it's in person in our clinics and even telehealth options, and often in a hybrid fashion in which we might have you come to our clinic for the initial assessment to really get a good idea of what those impairments are and make sure that we both feel comfortable with you progressing with these activities in your home setting as well.
Okay, everybody, thank you so much to the rehab team and to Dr. John for that great presentation. It's really exciting to hear about some of these strategies and how they can help improve quality of life. I personally like that suggestion about doing some exercises during commercial breaks. So I'm going to now turn it over to Dr. John. She is going to start with some questions that were submitted in the chat, and then also questions that were submitted previously. And if you have questions directly for some of the therapists, they're also available to help answer. Go ahead, Dr. John. Thank you.
Thank you, Kaya. Good evening, everyone. Good to see you all virtually. So as Kaya mentioned, I will start with some of the questions that we had submitted before this evening for the presentations this evening. So I'll just run through these questions first. Our team will answer them, and then we'll go through the questions in the chat. So the first question that I have here is, could you please describe recent studies looking at the relationship between exercise and remission? So there, as I think both the Lisas with physical therapy alluded to, there are multiple studies that have been done over several years, in fact, decades, that have shown the benefits of exercise with cancer prognoses and functional outcomes with cancer patients. And so two recent studies that were done as late as last year, 2020, and then even prior to that, included two large studies that actually looked at, so they were meta-analyses. These were studies that looked at large randomized controlled trials in the country. So the first published study was on breast cancer patients, and it basically looked at patients who received some structured exercise versus patients who did not receive a structured exercise program. And it basically showed that those who received the structured exercise programs had lower mortality from their cancer and other causes or other coexisting conditions that may not be related to their cancer. And so it was just another study that proved that if we increase your strength, if we increase your ability to function, your body can better handle some of the cancer treatments that you go through, as well as some of the surgical interventions that you have for cancer, and really help you just overall with your functioning and strength during your cancer journey. The second large study was in esophageal cancer and other GI cancer patients. And again, this was a meta-analysis which basically looked at many large randomized controlled trials across the country, and it showed very much the same effects as the breast cancer study did, that patients who had structured exercise programs did do better in terms of just their functional outcomes and their ability and their quality of life and their ability to function well after their cancer diagnosis. So that is the answer to the first question. The second question that I have here is, I need to build back muscle mass. How much and how hard can I exercise, and how much protein should I take each day? So I am going to also want to throw this out to the rest of the group, to our physical therapists or occupational therapists, in terms of the exercise question about how much and how hard you should exercise during your cancer journey. So I'm not sure if any of our therapists are on and would like to help answer that question.
Hi, this is one of the Lisas. I am the physical therapist, and some of the criteria that we use that you might have listened to in the presentation, we kind of talk about that somewhat hard effort level. So when we are looking at doing strength training, we do start with some of the functional movements and muscles first to make sure that's coming along. And then we look to focus at strengthening the major muscle groups. Repetitions, what research has shown is anywhere from 8 to 15 repetitions is sufficient. You don't have to do 30 repetitions of an activity. If that 8 to 15 repetitions starts to seem easy, you might consider bumping up in a weight, maybe a pound at a time if able. So that would be my recommendation.
Thanks, Lisa. So I will go on to the next question then that we have here that was submitted. Any new resources for dealing with chemo-induced neuropathy? So as your cancer rehabilitation physician, we have some medication options that can help, a variety of different medications that we look at each individual patient situation. And based on my exam, we will suggest these particular medications to start at low doses and then see how they are working for you. We also have, so these medications come in oral and topical forms. There are also a variety of different modalities that our therapists use to help with peripheral neuropathy. So again, I'm going to throw it out to our therapy group to see if any one of you would like to chip in and answer that question as well.
So as far as some of the neuropathies, I do know that it can vary from person to person. We can do some strategies to kind of help desensitize the nerves. So there's some different techniques that we can use to help with that. Some of them can be as basic as what we call a rice bucket, where we might have just some a bucket filled with rice, and you might move, whether if it's your feet, around in that to help desensitize, and then maybe try the activity that you're looking to do for exercise afterwards. We would also maybe want to check and make sure that the even footwear is appropriate and providing enough cushioning. Sometimes people will find benefit from compression type stockings where you get like a full contact compression, typically with the feet or with the hands and the gloves, that helps to provide some relief when you're doing those activities.
Thank you, Lisa. So the next question I have here is, how long might the fatigue and cognitive issues last post-treatment? Mine lasted longer than anticipated. So speaking specifically to fatigue or cancer-related fatigue, if the fatigue is solely due to the treatment that you've been receiving, chemotherapy, immunotherapy, hormonal therapy, it can last for 3 to 4 weeks or even longer after you stop the treatment. However, it can also last for many months after stopping treatment. And as I mentioned in my presentation, there are a variety of different factors that can contribute to cancer-related fatigue, and then some of them are medical, as I mentioned. And so I think it's very important to see your physical medicine and rehabilitation doctor to just run through some of those lab tests that might be needed or that you might have already had, just to see if we can catch any other contributing causes to fatigue. In addition, pain, sleep, some of the other concerns and issues that arise that can contribute to why you're feeling so tired. So I think those are important things to consider if you feel like your fatigue is lasting longer than you anticipated, to come in and rule out some of those medical causes that we can help address. And then of course, working closely with our therapists on strengthening, stretching, aerobic exercises to help combat that fatigue are absolutely very important as well. Another question here is, I'm curious about ways to manage scar tissue after cancer surgery. So speaking from a medical perspective, in terms of what I can do as a physician to help with that scar tissue, we usually, our therapists have great strategies. We always advocate for stretching, range of motion, just to loosen up the scar tissue and not have you have that limited range of motion with your limb or other areas of your body that scar tissue can affect. In conjunction with that, sometimes we can offer certain injections to help loosen up that scar tissue that can work really well with the therapies strategies. So I'm not sure if the therapists have anything to add from the therapy side in terms of ways to help manage scar tissue after cancer surgery.
As a physical therapist, we can address that with our manual techniques or hands-on techniques to address your, not just your muscle, but your skin, your fascia, your connective tissue, basically the layers that help hold your body together. We can do that with hands-on techniques, but then also through movements of exercise, just helping those tissues be more mobile. Sometimes we'll also teach you techniques to decrease the scar tissue. Sometimes some compression on the area using vitamin E. It's all very individual. So with that one, it's great to come in if you're finding restrictions and just have us take a look at it and individualize your treatment, just so we don't give you something over this video as well that could be difficult on your skin, especially if you're dealing with radiation tissue or post-radiation. You want to be careful with working in those areas as well.
Okay, I just want to maybe ask Dr. John to answer one more question. We're just at about 7:15 and want to be respectful of time. So Dr. John, is there one more there that you'd like to address? And just for those of you, if they were submitted, we will work with Dr. John and the therapy team to compile some of those answers and send them out via email to you as well. But one more question to Dr. John.
Yes, absolutely. So Kaya, I am trying to look through because I thought it might be nice to answer one of the questions in the chat since we were going through the questions that were submitted before. Are you able to see that first question that popped up in the chat?
Yeah, I think there was one specific to fatigue and metastatic disease. And then also, and maybe you touched on this, but for how long fatigue can last and what to kind of expect around the after treatment is complete, if you could put some words around that.
Absolutely. So I'll address the question about and I did see that here, can you address fatigue for people with metastatic disease? Absolutely, yes. Many of our patients that we see for cancer-related fatigue do have metastatic disease. We, as your medical providers, will work with your therapist to ensure that if there are any precautions, for example, if someone has METs to their spine and there are activity restrictions or things that we need to be careful about when you're working with therapies or when you're doing exercises at home, we work as a team together to help make sure that we keep those precautions in place, but we always advocate for continuing to be active, continuing to stay active, to do as much of the strengthening as you can, stretching and aerobic exercises, and our therapists are great at helping you to know how much you should do and the intensity of what you should do with that. So that's the answer to that question. In regards to, I know I touched on this before, but in regards to how long can cancer-related fatigue last, again, as I mentioned before, there are really a variety of the different things that can contribute to the fatigue itself. It can last for several weeks after stopping your chemotherapy or other medication regimens for cancer, but it can also last several months. And so that's why we together as a team look at a variety of different causes that could be contributing to the fatigue just besides the treatment for the cancer itself. As I mentioned, we look at labs, I look at imaging, I look at other causes of pain, sleep issues, and we really try and tackle each one of those. And if we find abnormalities, we can treat those, and there are those treatable causes of fatigue. So again, I think it's important to seek medical care, to see a physical medicine and rehab provider, as well as therapists, to try and tackle this at all angles.
Okay, thank you all so much to all of the participants that submitted questions, and then also to Dr. John and the rehab team for sharing their expertise with us tonight. We do have opportunity coming up, that survivorship forum or survivorship conference in April. There will be another session on cancer rehabilitation needs. So if any of you are interested there, you can find the link on the survivorship.umn.edu conference. Or the conference webpage there for registration information. And then next week on Tuesday night, as part of the forum, we will invite Dr. Jeff Kendall, who is our psycho-oncologist as part of the cancer care service line at M Health Fairview, or psycho-oncology, I'm sorry, he works at WIN. And he will be here to talk about stress management and cancer diagnosis and treatment, which I think is all part of our lives here with our current world scenario. So we're so thankful for all of you joining us tonight, and we look forward to seeing you next Tuesday night. Thanks so much, everybody. Good night.